Well, all the people in the hospital were key players in improving our quality of care. But the ones who had stayed after the merger of the two hospitals through a very tumultuous and demoralizing period of time clearly feel an affinity for the organization and a great affection for the organization and for the patients who come here. So they were an important segment of the group that helped make quality improvement the number one priority. On the other hand, there were some new people who arrived, like a new chief of medicine, Mark Zidell, and other people, who brought in some ideas and some perspectives that had not previously been considered here. So it was the two groups together who really made it happen.
We went through a very difficult merger of two large institutions in the late 1990s, and while that merger was difficult, I think there was a sort of evolutionary process that occurred by virtue of that merger, where the individuals in leadership positions who were not entirely committed to the institution chose to leave. Staff who were not entirely committed to the institution chose to leave. And the people that remained and the people that chose to come here in the midst of that environment, which was challenging, were those folks who enjoy change, are prepared to embrace somewhat dramatic change in the model of the institution.
So it was really hard. It was a really difficult time. A lot of my colleagues were leaving. Every day people would say to me, "Why are you staying? Why aren't you leaving? Why aren't you coming with us? Why are you staying here? What is it that's keeping you here?" And now that I really think about it, I think it was really belief. I think that it was such a tough time, and I felt committed and dedicated to the organization, but I think I really believed in what I saw and what I heard. And it was from Paul, it was from the leadership team, it was from the people that I worked with every day. What I saw was that people were committed to patients. What I heard was that the vision was that we would continue to provide extraordinary care to patients and focus on quality and safety. All of us just did what we had to do. We kept working. We worked really hard. We focused on what was important. We continued to take extraordinary care of patients. Sure, we were committed to the organization. We were dedicated. But I think it was the belief in the organization and the people that we worked with is what really got us through and what has us here, all of us here today.